Today, the Trump administration's restructuring of the Department of Health and Human Services came in the form of widespread job termination emails at the Food and Drug Administration and the CDC. CBS News has learned that the cuts include senior leaders and staff focused on HIV prevention, reproductive health, and respiratory diseases. To help us understand the impact, we are joined by Kathleen Sebelius, former HHS secretary in the Obama administration, for tonight's interview. And there is Secretary Sebelius. Thank you so much for joining us. Just as a preliminary question, when you looked at the cuts, given your experience, what was your gut and immediate reaction to those numbers?
Well, John, I was somewhat horrified. Remember that there have already been about 10,000 jobs eliminated by people who chose to take an early retirement or the so-called offer of a buyout. So they left somewhat voluntarily at the beginning of the administration. Then probationary workers, which are all the, best and the brightest, youngest people who are trained, who have been vetted, who were recruited, who were ready to go in their jobs, they were eliminated across the board in all of these agencies. And then there was an announcement by the now 6-week-old Secretary of Health and Human Services, Robert F. Kennedy Jr., that another 10,000 employees across the department will be eliminated.
When you think of the specifics, though, of how this will affect people and health, what comes to mind?
Well, HHS deals with Americans from birth to death. There is absolutely no way you can lose 25% of the workforce, which is what he's talking about, without directly affecting Americans across this country, whether it's child care services that they rely on, which won't get the block grants in time, aging services, people who want mental health help, CMS, which runs the largest insurance programs in the country for Medicare and Medicaid, research and science at NIH, which is the gold standard of the world, Food and Drug Administration regulating 25 cents of every dollar consumers spend on food and cosmetics and drugs and medicines. So this will have a devastating impact on the health and well-being of Americans.
And help us understand, because this is being done in the name of efficiency, according to the administration. Certainly there have been reports, and when you were there, you would have seen some level of bureaucratic complexity, let's put it that way. Help people understand the difference between what you witnessed and whatever you may have seen in inefficiencies, leaving aside the size and scope of what the administration is trying to do.
Well, I think let's start with the fact that this administration is brand new. They can't possibly know what even the agencies do, much less what people in the agencies do. So the kind of cuts they're talking about are just slashing jobs by title, by name. They're picking people out. They're picking agencies out that they just don't like. There is no understanding of who is doing good work, what's essential work, what grinds to a halt if they're not there. The agencies are also very different sizes. Some are very small. Indian Health Services and Community Living is a much smaller agency. Children and Families is always understaffed. Some of the agencies have, a large amount of people. But again, I don't know any employer in the private sector who would just slash employees regardless of what kind of work they were doing, how essential the project is, before he or she knew what was going on. And that's what's really alarming to me, that these folks don't know, or they don't care what the impact will be on the health and well-being of Americans.
Former Secretary of HHS, Kathleen Sebelius, thank you so much for being with us.